So health for Orem then is when people are functionally whole or sound. So they are able to function and able to live their life in as normal a way as possible. And so it is about the physiological and the psychological, so physical and mental ideas and interaction with other people and living our life as normal as possible. So for her, you can actually have chronic disease and be considered a normal person and be living your life. Because as long as you're living as close to normal, your own normal as possible, then you would be considered healthy. The environment for her is about understanding everything around you and the development of everything around you and how these factors might impact your care. So for Orem, healthcare, the healthcare environment and where nursing can happen can occur really anywhere. It can happen in your home, it can happen in the community, in the hospital, or in anywhere that it happens that you might experience a negative change in your self-care and then get help to deal with your self-care problems. So she says that nursing can happen anywhere, and the environment is everything around you, your being, and all the elements of life and society. So person for her is men, women, and children. So she really defined it very specifically. She didn't say just the individual. She said a person can be a man, a woman, or a child, and it can be either one person or a group of people dealing with a self-care deficit. And really it's anybody that we are providing nursing care to, is the way she defines it. And so a human being is a person is only in need of nursing care when they have a self-care deficit. So a person to her is really somebody who is experiencing some sort of self-care deficit. So if you are not experiencing self-care, there's a deficit in your self-care, there is no need to seek nursing services. And so you are kind of ignored in her model. You have to be experiencing a negative implication of your life in order to be a person within her idea. And basically, kind of like the way Roy considers adaptation and coping, she says that we can only deal with so much deficit before we really need help. And this is where we help our patients. When they can no longer deal with the amount of negative or deficit in their life, then nursing needs to assist them.